Well, good afternoon. Welcome again. This afternoon we're going to talk a little bit about the bailiwick's gradual return to normality, and Deputy Salisbury will speak in a moment about the first week of Phase 4, and Dr Raby is going to talk about the resumption of hospital services. We're also going to focus quite heavily this week on self-isolation and what it really means. With so-called non-essential travel permitted in Phase 4 from last Saturday, we are seeing, and to be fair, as expected, more travel. But I think there is a risk that some people have confused the term non-essential travel with the reference to unlocking the borders, which was talked about in the context of Phase 6 of the exit strategy, and may have assumed that in some way we've brought that forward, which we haven't. It's not the case. And I think the picture's been further confused by the UK introducing its own self-isolation regime from next Monday, the 8th of June, which of course has its own set of rules and its own set of exemptions, none of which of course apply here in the bailiwick. The fact remains that at the moment, apart from a few essential workers, everyone entering the bailiwick from outside, whether by air, by sea, by private boat or private aircraft, will be required by law to self-isolate for 14 days. Now, this may change in the future. I can't say what those changes might be and when they might indeed be made, simply because those decisions have not yet been taken in that regard. But 14 days self-isolation is the current position. And self-isolation really is not a soft option. It is so much more than just staying at home, and Dr Brink will explain in a moment what it means in practice. The self-isolation requirement is of course supported by a legal enforcement regime, including hefty fines, which purely by coincidence, although one that I'm personally very happy with, we've actually seen used by the courts this week. It cannot be emphasised enough that so long as the prevalence and reinfection rate, the R number, of the virus at the point of the traveller's origin is high, as of course it remains in the UK right now, the self-isolation regime is our main defence against the virus coming back into our community and all that would follow from that, risking the rapid progress that we have made in our exit strategy. And we are simply not prepared to run that risk right now. It's not fair for the community as a whole. And so it is important that anyone travelling does adhere to the self-isolation regime or risk a heavy fine for breaching the requirement. In short, personally, although I can, of course, like everyone else, travel for non-essential reasons, I won't be bothering to do so, as I actually think the burden of self-isolation on return is just too high a price to pay for a journey which is, by definition, not essential. Next, I want to turn to a bit of a taster for next week. We will be publishing our high-level recovery strategy under the working title of Revive and Thrive. The overarching aim is to be economically better off than we would have been in 3 years' time without any action or intervention. And to achieve this, we will need to be prepared to invest in recovery, and the funding that will need to come in due course from borrowing further sums, and of course that will require further parliamentary scrutiny, debate and approval in due course. It is a high-level strategy, and I must emphasise and stress that, covering several years, and a lot of detail and nitty-gritty will need to be developed later. It's a strategy for the bailiwick, not just for government, and like the COVID-19 response itself, it will need buy-in from the community as a whole. We will be engaging with business and the third sector, the charity sector, and others after the strategy is released. Frankly, we would have preferred to do it before, but we've not done so simply because of the need for speed and the lack of time available to do so. We will be asking the presiding officer of the States of Deliberation if it can be debated at the Assembly's next sitting, which begins the following week on the 17th of June. As I said, it is high level, and there's a lot of work we'll need to follow to develop detailed action plans, although it does contain some short-term actions which we will announce when it's published next week. I'm aware that next week is also Carers Week, with Carers Guernsey raising awareness for carers, especially those who are unpaid, looking after a loved one, with a campaign using the hashtag #ICare. I know that this lockdown period has been very hard for many of you. Your role as a carer, rewarding and as loving as it surely is, and having done it myself, albeit for a short period, it is hard, I know, even at the best of times and in normal times. I don't think we think of you often enough, and next week when Carers Guernsey looks to highlight what you do, I'd ask that the media do support them in that, and that actually all of us as islanders do pay attention to the message that they are seeking to get across. So thank you to Carers Guernsey for your work, and also, of course, to all carers, paid and unpaid, for everything that you do in our community. Finally, I want to say a few words before all the schools go back next week. For those of you who were able to start back this week, well done for getting back into the swing. But mainly I want to say thank you to so many people for keeping education going since mid-March, to the teachers and of course all the other school staff who have worked throughout to enable vulnerable children and those of essential workers to continue to go to school. To the parents and carers who have supported home education and remote learning, often, of course, whilst working or trying to work from home themselves. And I know many of us now have a far greater appreciation that teaching, it really is not an easy profession by any means, and will be very pleased to hand back control to the experts. And of course to the children and students themselves, many of whom have actually submitted questions that we will get to at around about 1:45, who have had to develop new ways of learning whilst being separated, of course, from their friends. So good luck to everyone for the safe restart of education next week, and thanks to all of those who have worked hard together to enable that to happen. So that's enough from me, and Heidi, next.
Thanks, Gavin. So we're now a week into phase 4 and we have no new positive cases. It's therefore understandable that some of you may be asking why we just don't move to phase 5 now. Now, in responding to that, I think it is important that we don't forget just how quickly we've moved since lockdown. Indeed, faster than we possibly could have imagined a couple of months ago. But at the same time, in a logical way, based on the evidence and taking into account what we know of the virus and how it spreads. Phase 4, which we've introduced at the earliest opportunity, has been a profound change, albeit things are a bit different from before lockdown, such as needing to queue to get into the shop, giving your name at a cafe, and not being able to stand at the bar. Whilst it is great news that we've reached this phase so quickly, complacency is our biggest enemy. The need to follow public health advice, in particular social distancing and hygiene guidance, is essential at this stage, ensuring any cases that are out there can be managed and the spread of infection controlled. At the same time, health and care services need to follow public health advice like everyone else. Just as in the wider community, things can't go back to where they were immediately. Therefore, I am asking you to continue to work with us and be patient as we work through the exit phases. We know that even before the COVID-19 pandemic, people were waiting patiently for certain procedures or services. COVID-19 has clearly resulted in longer delays, as in elsewhere in the world. Of course, this is far from ideal and is frustrating for all concerned, including my committee, especially given the improvements that have been made pre-pandemic. Because of the fantastic response from all of you supporting our public health messages, we have been able to restart services ahead of many other jurisdictions in Western Europe. But we can't bring everything back all at once. To do so would compromise the safety of service users and our staff. Reduced services won't last forever, but I am afraid they are a reality in phase 4. Dr. Raby will provide more information in a minute on what services will look like in phase 4. But the comms team have also prepared some graphics to show you what services are being provided now and how these will be extended in phases 5 and 6. This information is also available from the coronavirus webpage on gov.gg and will be on social media over the next couple of days. Please bear with us. We are working as quickly as we can to get services back to normal. But most importantly, please support our staff, like Dr. Raby, working hard to make that happen. So moving on, as we slowly phase back to normality, the Committee for Health and Social Care wants to understand how your lives have been affected by lockdown, building what we've heard both anecdotally and through the many of you who have contributed through the community monitoring tool. Next week, we'll be publishing a survey which asks you to share your experiences. We'd like to know what has worked well, but also what has been hard for you and what you think we could have done better. You'll have seen over the past few weeks that there are two important strands to the committee's way of working. First, we seek to understand and apply the evidence, and second, we try to find solutions that work for Guernsey and reflect the things that make us special or unique. This has been true of our approach to the pandemic, but I think it also describes our approach to all areas of our work. That's why before the pandemic, we'd started a series of what are called JSNAs, or Joint Strategic Needs Assessments, which seek to understand Islanders' health and wellbeing needs and how we can make our services work well for you. So this survey continues that approach. It's part of our commitment to keep learning and to build back better. You know that there's a risk we might find ourselves running to an earlier phase of lockdown in future. If that happens, we want to be able to take into account the things you found challenging this time and see if there's anything we can do to help make things better in the future. Even if, as we all hope, we don't have to return to an earlier phase, you'll know that public health makes regular plans to make sure we're prepared for the risk of a future pandemic. So it's vitally important that we take this opportunity to learn from what we as a community have just been through while it's still fresh in our minds. That way we'll help to ensure that our island is even better prepared for any new challenges we may face in future. And I'll say more on that this next week. And finally, for those who haven't yet heard, yesterday the committee agreed to extend the opening hours for licensed premises to 11:30 p.m. as of today. We're happy with the way things have gone this week, and as well as considering how it would help the hospitality industry, thought it made sense to make the change at the earliest opportunity. So cheers.
Thanks, Heidi. Dr. Raby.
Thank you. Just for information, the hospital is working much more like normal again now. So we're seeing more activity coming through outpatients. I say the hospital, I should include the MSG premises as well. Much more activity coming through outpatients. Certainly a big increase in face-to-face outpatient activity compared to telephone consultations, and that's going up. ED attendances are up again, and that's good because it means people are having confidence to come back to the hospital when they need to. But as Heidi's told you, the story really at the moment is people are worried about what's happened to waiting lists and what's happened to their operations and their procedures that they've been waiting for during this time. And the first thing I have to say is thank you for bearing with us, because the pressures have been enormous, and just like every other jurisdiction in the world, we've not been able to do the amount of planned surgery and the amount of planned activity that we would normally have done in this time. We're delighted that we can make some sort of start on that again, and in phase 4 we have done. So we did as many cases in theatre so far this week as we did in 2 weeks during the lockdown period. So we're double the theatre capacity with plans to go higher very quickly. But the waiting lists have grown. Since the 1st of March, we've put nearly 1,400 patients onto the waiting list here, and we've taken just about 1,000 off. So we've been working hard, but not able to keep up with the numbers going onto the list. We're going to see this everywhere. The UK is talking of having up to 7 million on their NHS waiting list at the end of this pandemic. And so you'll be worried about what's happened to you on the list, and we understand that. We're doing all we can to get these theatres working as quickly and as well as we can. And in phase 4, we've been concentrating on patients where the risk to the patient is as low as possible, even if they were to develop symptoms after their operation. There's a reason we've chosen this group, and it's because there's some evidence that people who get COVID disease in the period immediately after an operation seem to be at quite high risk. And so we've been concentrating on people who are having less major surgery, people who are a bit younger and a bit less at risk if they were to get COVID, because until we know that your chance of coming to theatre and not getting it in the post-op period, not because you pick it up in hospital, but because you're incubating it when you come into the hospital. We're trying to protect those people. When we move to phase 5, and we all hope that won't be too far away, we're going to change our tactics a little bit, and we're going to start concentrating on the very high-risk patients who've been waiting for a long time. So we'll be looking at the elderly and people with comorbidities and people who need their operation, but we haven't felt it was safe for them to go during this time. And that's because when we enter phase 5, the risks might be as low as they ever get with COVID in Guernsey. And so we want to concentrate on those patients. You know that we're asking people to self-isolate before the surgery at the moment. The reason for that is purely to protect them from incubating the virus at the time of their operation. And I know it's inconvenient, and we're really grateful to people who've made the effort to do that and to come for operations. We need to continue that at least until we get into phase 5. And even when we enter phase 5, we're going to be advising people to think carefully about doing that, because it's for your own protection. So those are some key things about surgery in Guernsey. I want to touch on the Southampton experience because you all know that Southampton, in fact the UK, are asking people to self-isolate for 14 days before surgery there as well. And it's kind of a double whammy for Guernsey patients because they're asked to self-isolate here before they go to Southampton, and then when they come back they've got that same experience again, 2 weeks of self-isolation. Now our position, we believe, is very different to the UK's position. And I've contacted Southampton hospitals to say, is there a way that we can agree a self-isolation protocol for Guernsey patients going to Southampton that might be slightly more flexible to recognise our unique circumstances? We haven't agreed that yet. I can make no promises, but we hope that at least something might be done with Southampton to recognise our position in that circumstance. So that's probably enough about surgery and outpatients. I'll move on to the next. Thank you.
Great, thank you very much, Peter. Paul.
As mentioned earlier, as part of entering phase 4, non-essential travel is now possible. Our phone lines have been exceptionally busy, and there's been quite a lot of discussion about this online this week. I think it's important, therefore, to clarify and reassure the community that very strict measures are still in place for anyone arriving in the island. There are limited numbers of reasons for exemption, and as noted by Deputy St-Pierre, unless one of these exemptions applies, anyone arriving in the island must, by law, self-isolate for 14 days. So while non-essential travel is now possible, any member of our community deciding to travel off-island will have to self-isolate for 14 days upon their return. Likewise, anyone visiting the island will have to do the same. Guernsey Border Agency officers meet every flight and make passengers aware of the need to self-isolate. Take addresses and contact details for all arriving passengers, and they are contacted regularly to both check on their welfare but also ensure they are self-isolating appropriately. Spot checks are also carried out at the addresses provided by passengers, and significant penalties are in place, up to a £10,000 fine, if anyone breaches self-isolation requirements. As mentioned earlier, we actually saw the first person in court yesterday for this offence whom received a significant fine. Disregard for these restrictions has been taken very seriously, and they remain critically important to protecting the fantastic stage Guernsey has achieved in managing this pandemic. Phase 4 will also see the return of all students to schools, and a huge amount of work has been carried out by the Committee and Office for Education, supporting head teachers and their staff this week to prepare and ensure all necessary measures are in place to comply with public health guidance. Parents and carers should have received guidance this week from their children's school, including information about how each school will operate, as understandably individual schools had to put specific measures in place that work for them and the layout of their school site. This has been a complex area of work, and parents and carers are asked to bear with the schools if everything doesn't run perfectly from day one. Schools, students and parents must adapt to the new ways of working. Monday, however, is rightly a day of celebration, as it highlights our success as a community in meeting the challenges of this pandemic, and we know that head teachers and their staff are really looking forward to welcoming students back to their school communities. To help with congestion in school car parks and reduce the number of school buses, it's been requested that as many pupils that can, please walk and cycle to school. One of the positives of the last couple of months has been seeing so many more people walking and out on their bikes. We know it's not feasible or indeed practical for everyone, but it would be great to see as many as possible getting to school in this way. Of course, taking care and road safety in mind at all times. And please, for all motorists, we have become used to less movement around school sites, especially at peak times. Please be alert to the increased numbers of pedestrians and traffic at our school return to normal flows of activity. If you do want a place for your child on the school bus, then please remember that numbers are restricted and you will need to register a place. All details are now available online how you would do so. Lastly, administrative public service buildings continue to be closed to the public at this stage, as efforts are made to regulate the number of employees returning where it is necessary to do so entering phase 4. Importantly, we're currently reviewing where there is greatest need to resume counter services. We acknowledge increased use of technology and call centre capability has allowed 90% of our customer transactions now being completed online or over the phone. In providing any necessary face-to-face counter service, we are reconfiguring provision to reduce our counter services to fewer sites. We'll provide more details next week, but if you have any questions or concerns, please call or contact the relevant service. Thank you.
All right, thanks, Paul. Dr. Brink.
Thank you. So we're now day 36, no new cases, so really encouraging from that perspective. And what we're now doing is looking towards what else we have to do for the rest of this year. So, of course, we're preparing for a possible or a potential second wave. It would be remiss of us not to prepare for that. So we are making sure that we're fully prepared for that. We hope we won't see that. We're also thinking about what we would do if we see an individual case, a cluster of cases, but importantly, we're preparing for our winter flu season as well. So we're integrating all of that. We decided, looking at how we can do COVID testing alongside testing for other respiratory viruses in the winter, such as influenza and respiratory syncytial virus. We're preparing for our winter flu vaccination season. So all of those preventative and preparatory work is really, really important. Alongside that, we've started with our extended surveillance program early, and so this is BETS, the Bailiwick Extended Testing Strategy, and for that we are expecting delivery of our new piece of equipment in the next week, 10 days, and we'll then standardise it after that. But because we've got so few symptomatic cases, we've started testing asymptomatic. We've now tested in the region of 600 asymptomatic people, and we've found no positives in that group. So again, really encouraging data. And that really backtracks onto what we're hearing from primary care. So primary care aren't reporting any untoward activity, respiratory virus, or other symptoms that are associated with COVID virus, loss of sense of smell and taste. They're not reporting any activity. Dr. Raby is not reporting any activity within the hospital. So as far as we can see, we've got little or no COVID activity at present on the island. But we know the greatest risk for us is the re-importation of a case. All of the early cases were due to the importation of cases, and that first wave that we saw were all imported cases and contacts of those cases. So what we need to be sure is that we have strategies in place to prevent and manage those. And one of those is at the moment our compulsory 14-day self-isolation. And I'd just like to focus a little bit on what that compulsory 14-day self-isolation is. It's not just, well, I go home and do whatever I want at home. Self-isolation is exactly what it says. So you have to isolate from the rest of the people in the house you're in. You need to stay by yourself in a room. There are certain things that we'd ask you to do. So, for example, if you don't have your own bathroom, use the bathroom last. Use the kitchen separately. You can't have meals with the other people in your house. So really, it's very, very well described what we need to do. And that information is on gov.gg. So I'd just like to remind each other, self-isolation is not just staying at home. It's exactly what it says. It's self-isolation by yourself and staying away from everyone else. And that's what will prevent ongoing transmission. Now, of course, as things change, we might relook at things, reevaluate them. We do that all the time. But I think it's important that we heed that message for the time being while we want to prevent imported cases. I think the final thing that I'd like to say is that we've gone into phase 4 and the community response has been magnificent. It really has been good. And we've heard very few problems. We've had extremely positive feedback from people contacting us in public health, giving us information that we can perhaps improve, but also areas that are working well. And that type of feedback that we get is really important. So we can't be complacent, but also we must appreciate and celebrate how well the community has responded and how well they're coping with phase 4. And we'd like to, if we progress through phase 4 well, we'd like to accelerate as fast as we can to phase 5, which essentially will mean that everything in the bailiwick is open. So just from me and from Public Health Services, thank you very much to everyone for helping us so far on this journey.
Thank you very much. Nikki, just one question I wanted to pick up there was, because of the testing of asymptomatic individuals now, that means that in the daily report of number of those that are awaiting results,
Yes.
I know there'll be some members of the community who are watching those statistics
Yes.
avidly.
Yes.
And really, I guess a key message is it shouldn't be of concern if that awaiting results seems high, because it's part of the bailiwick extended testing strategy. Is that right?
Yeah, exactly. It's part of the extended testing strategy. And for example, if we know that someone's having surgery, we'll give them a booked slot so they'll know they're going for their test, but that might be in a week, 10 days' time. So they'll then go into the awaiting results because they've been booked into the system. So it's just an explanation. So everyone on awaiting results has booked in and got a test slot. But those numbers may well go up quite considerably as Dr. Raby opens the hospital up to more surgical procedures. And I think that's a really important point. So those numbers may go up. But anyone who is symptomatic, the swab to test result time will be 24 hours or less, and I think that's really important, and that then enables us to get our track and trace program, because as I think you all know, we aim to get our contact tracing going within an hour of getting a positive result. So our contact tracers are on call 24 hours a day, 7 days a week, so we've always got access to a contact tracer to come in and deal with a positive result. So I think that's a really important point. So thank you.
Good. We've got about 20 minutes for questions before we turn to some of the questions that are coming from children. Who'd like to kick off, please? Yes, Charlotte.
So just Charlotte Gay, ITV Channel, talking about the confusion you highlighted at the beginning, what have you heard about people getting confused about what is allowed and what isn't allowed? What examples have there been? And also, my understanding was that phase 5 was when bailiwick-wide travel would be allowed, but as we know, the Sark Shipping has started their passenger journeys Tuesday. Herm with the Trident is going. Are you saying that people should only be making them as essential journeys, or can people go on holiday to these places? What is allowed at the moment?
Well, I mean, clearly, intra-bailiwick travel within the islands of the bailiwick is fine. In terms of going off island, the advice is now clear that if you wish to go off island, you can. But I think it's really emphasising the point that whilst you can't, as we've said all along, with all of the relaxations as the phases have come through, just because you can do something doesn't mean you should. And I think people need to have everybody needs, who is thinking about travelling off island for a non-essential reason, and I guess I'm distinguishing from a reason that the individual will regard as absolutely essential. That could be, illness of a member of the family elsewhere, or it could be a wedding, or it could be a funeral, or it could be a whole raft of things that the individual would judge to be essential. If it doesn't fit that category and is therefore non-essential, it's just being really aware of the level of expectation the legal obligation that will be upon you on your return. And I think the reason for making those comments at the beginning is what's been quite clear is the questions that have come through either directly to Heidi and I into our email inboxes or through social media seems to be raising an expectation that there is now general travel permitted, or general travel is going to increase quite quickly with new renewal of air and sea passenger services. Yes, it's possible, but it's not going to happen yet because of that constraint on your return. Next question. Yes.
Hayden Atkins, BBC Guernsey. As island businesses continue their return to work and employment and the new normal for them, I want to just ask a bit about the state's furlough scheme in the sense of how long that might be carrying on for, and if it does change, whether changes will mean the state's paying less or more in the weeks and months to come.
Yeah, I think the first thing to make clear is, of course, the state's scheme is a co-payment scheme, so it's distinguished from the furlough schemes which exist and are referred to elsewhere. So, and it's quite an important distinction because the states have never required the employee not to work at all, which is a feature of the schemes that exist elsewhere. So it's very much supporting the employer, continuing to keep the employee on the payroll. It will continue until the end of June. That's already been made clear. We've already said and identified that there are certain sectors, and the visitor economy is an obvious one, that will continue to be impacted, and that those policy decisions have not yet been taken. But we are conscious that those sectors will very likely need ongoing support. I can't say any more than that. Not because I don't want to. It's just simply the decisions haven't been taken. Okay, next question. Yes, Daniel.
Daniel Keeley, Guernsey Press. Is there any change in the thinking now that the UK is recommending face covering on public transport, or is it not necessary here, given the lack of cases? And will that change once the borders open up?
Okay, Nikki, would you like to deal with that one?
So I think as last Friday we announced that we were strongly recommending that people wear face masks on Aurigny when they travel in and out. And the reason for that is you're looking at travel in and out the bailiwick, and you're in a confined area with no natural ventilation. So travel in and on and off the bailiwick, we are recommending face masks, and indeed that's already been implemented from last week, from the start of this week at least. We're not recommending face masks for intra-bailiwick travel, so on buses and so on. Every single intervention that we've put in place, we've justified to the population of Guernsey with evidence. So we're day 36 today. We have no evidence of COVID-19 in our population. It would not, in my view, be proportionate to recommend putting face masks on people travelling within the bailiwick. So in and out of the bailiwick, that's a different story. We are in an entirely different situation to, for example, the situation in the UK where there's evidence of ongoing community transmission. We don't have that here. So it won't be our recommendation to use within the bailiwick, but we will be recommending in and out the bailiwick. The reason being is with non-essential travel being included, inevitably the planes will get more full, and for that reason we feel that a mask is appropriate under those circumstances.
Okay, thanks. Laura.
Laura Clayton, Bailiwick Express. Are you able to clarify for us under what circumstances people are exempt from the need to self-isolate when they come to Guernsey, with particular reference to the construction industry and commercial fishermen, because we've heard this week there seem to be quite a few concerns around one particular building site in Guernsey, and also we've heard that some commercial fishermen have resumed landing their catches in France and are then coming back to Guernsey and not isolating them when they come back from doing their business.
Okay, who is best placed to deal with the process by which essential workers are defined and approved?
Essential workers are defined in the law, and it's clear anybody who wants to read that who are, and it's a whole list of people. But I wasn't aware of what the fishermen were doing, quite frankly. And I don't know if, Nikki, you've got any more on construction.
Not on the construction. We're working that. In fact, we were meeting industry representatives last night as to how we can extend that and accommodate some of their requirements and needs, and they're going away to think about some of that, and we were putting that into planning going forward. In regard to the fishermen, although I'm not aware of the absolute details, but I know request has been made for potentially fishermen who take a catch, land the catch, but don't leave their vessel. So in other words, the catch is taken from the vessel and the vessel is returned. I'm not sure how far that has got in that stage, but I know it is being looked at.
Well, certainly it's not come to my committee yet, and the directions have, I don't think in terms of the definition of essential workers has changed since the very first one, actually. So but that's where people need to go, is to look at the directions and understand who are considered essential workers.
Okay, next question. So we'll go
I
back to
have
Charlie.
a question that was put to us from a restaurateur. They would like to run their business properly. They need to bring in more staff who obviously went just before the lockdown rules came in. To do that, they understand that they would need to self-isolate on their arrival into the island, but they ask, with bearing in mind the new fines and punishments if self-isolation is breached, could Guernsey be more like countries like Australia, where the authorities there take responsibility of putting workers into quarantine, state-run quarantine hotels, rather than the onus being on the employers? So, for instance, say they bring somebody over to work in a restaurant and they break the rules. At the moment, I understand there is a risk that the employer themselves could be at risk of being fined. And I think they're worried about bringing people in and then them being responsible if they were to break self-isolation.
Well, I think that the first comment I would make in relation to any employer who needs employees would be to tap into the local market. We have higher rates of unemployment now than we did 3 months ago. So there is a pool of people who will be looking for work, and that, I would, and certainly the conversations I've had with employers, that would be the first port of call. Beyond that, of course, the normal population management regime will apply, and processes will apply if people do want to come in. But absolutely, it will remain a requirement that they will need to self-isolate. I'm not sure it should be the responsibility of government to take the burden of looking after private businesses wanting to bring in those from overseas to work here. But sorry, Heidi, do you want to make further comment?
No, I agree with Gavin here. I mean, really, it's the onus on the employer, and if they feel that to ensure that their staff do what they're expected to do, and that's what we put in the law specifically to make sure it happened. We're concerned that somebody has to take responsibility here and make sure that people abide by our laws and be well aware of them. There have been discussions previously about whether we have quarantine people in hotels, and you need to find those hotels that be willing to do that, because there aren't state-controlled hotels from that point of view. And because I know that the Isle of Man uses hotels to quarantine people, but that's certainly not something we've been thinking at this stage. But in the future, but when we look at increasing number of people over, it might be something that we consider, but not at this stage, no. Yeah,
so I think, in summary, if an employer believes that the only way they can get their business up and running is to bring people in, they can't find anybody locally, then they will need to follow the processes. They'll need to identify whether the individual is an essential worker, as we've talked about before. If they're not, they will need to quarantine them. And take responsibility for that and make sure that employee contractor does not start work before the quarantine period is complete. Hayden, and then back to Laura.
You mentioned earlier, you said yourself and laid out some more distinguished ideas on essential travel, non-essential travel, and said yourself that you won't be travelling for the meanwhile. Do you have any indication at this stage of when the borders may be reopening in earnest without that need to self-isolate, or is it still too early to say, with so many listeners who have trips that they want and need to make, and it's a question that's asked every single day?
I mean, I completely. I'm sure we're all in the same position, that we've all got either ourselves may have plans or had plans or have family who want to travel or want to come here. So in a sense, I've got empathy with everybody who's asking this question, because I think we're all in the same boat on that. The reality is we're simply not able to give a definitive answer to that question yet. As ever, so we've been clear all along, everything remains under constant review. We are looking at this whole question. But as we've said before, the reality is that so long as the majority of those who are inbound into the island are going to be coming from an area which remains a very an area with high prevalence, one of the highest in Europe, or the highest in Europe, I think, probably at the moment, that is a significant concern and risk for us. So I think until that changes, and it could change for a whole variety of reasons, including the measures which have been taken in the UK, but also the progression of the virus itself anyway, that's probably the single most important factor. But we will keep it under review, and we will announce any changes just as quickly as we can. But the priority has to be to do it safely. Heidi?
And we're not unique in this. There are other jurisdictions who are in a fortunate place as we are, like New Zealand in particular, and seem to have followed a very similar path to them, who are doing the same thing, have got the same concerns, and the public and the community are asking the same questions. And understand how really frustrating it is. I've got family in the UK I would love to see, and I can't at the moment. And we can't, because unless they self-isolate, we can't do it. But as soon as we can, I can assure everybody out there, we will. It's just having to rely and understand what's going on elsewhere, either vaccine, and we can get a vaccine faster than we thought we could, or that our nearest neighbours and in the UK, that they're managing to get on top of it. So we can then start considering how we open up the borders, but not at the moment, I'm sorry.
Actually, I'm glad Heidi mentioned New Zealand, because actually I had a meeting with the Acting High Commissioner for New Zealand, who's based in London, obviously, by video conference this week. And this very issue was the one that we're very interested in working, particularly through the public health team, to identify, because we have a common challenge about how we reopen our borders, as indeed they do. And New Zealand is in 10% of their economy is reliant on the visitor economy, and also there is no way you can get to New Zealand without transferring a flight from somewhere. You have to change planes somewhere. So they have a very real challenge, but they are not keen to be in the vanguard of change. They're keen to understand the risk, and hopefully we may be able to work with them. That's something that we're very much looking at, to see whether we can develop some kind of common protocols and understanding of risk that can then be properly mitigated and managed. Laura?
Just moving away from those topics then, there's lots of talk about building back better as we come out of lockdown further, and I've seen some people already seem to be mourning the loss of our much quieter island life we experienced over the last few months. Are you able to give us any indication yet of what might be in the planning as we try and build back better?
Yeah, I mean, it's an excellent question. I mean, it clearly has been quite a significant feature. In fact, Heidi and I have been receiving quite a lot of emails, as have all our colleagues, in relation to cycling and cycle infrastructure and the roads, and what can be done to secure some of the benefits which people felt in terms of being able to safely use the roads, either for walking or for cycling. So I think it is going to be incumbent on us, as part of the recovery strategy, or recovery plans, I should say, the action plans that will emerge from the high-level strategy. But as I said, some of these things will require investment, and it will require a commitment and a decision to provide money, because some of these things will not happen without funds being provided. So, I mean, this is absolutely when we've talked at these conferences before about the need to seize the strategic opportunities, the desire of the community for change, if we wish to seize that, then we do now have the opportunity. But it is going to require some both political commitment, but also funds to enable it to happen.
I think if we do, we've got to do it quickly. I think the longer we leave it, the less likely it will happen. And the way the state's traditionally has worked has been so slow and pondersome, and we have policy letters that take months to get there. I think we've got to follow what's happened over the last few months and really embrace new ways of working to make it happen. Talk to the community, listen to the community. I'm hoping the survey that we publish next week will help to get that feedback about what the community wants to see for the future, and whether it's revive and thrive or building back better, what it means and what we want to see, and what's really benefited us in all the horrible things that people have had to put up with. But there have been some good things. The quieter roads clearly has come through loud and clear from a lot of people, and we need to build on that right now before it's too late.
Okay, one more question before we move it. Danielle.
With the world likely to enter a deep recession, what hope can you give school leavers and young people who are likely to feel the impact and the financial impact the most? Will the recovery package guarantee help and training for them at all?
Yeah, it's a very good question in terms of the impact of the world economy on our own economy. Clearly, the fact that we've been able to restart our own domestic economy more quickly than perhaps we might reasonably have been expected is good news for the domestic economy and for jobs, and therefore for job opportunities that may follow for school leavers this year, particularly. The impact, obviously, on those that are looking to go on to higher education and whether they'll be able to do that this year in the normal way is clearly a factor as well. But I think there is we shouldn't lose sight of the fact that I think there is a real sense of the Guernsey Together spirit and the community spirit and the optimism, actually. In many ways, I think there is more optimism now than there was 3 months ago in the community, because the recognition we've had in the national and international stage, because what we've achieved, and that gives us a buoyancy which I think will really help our recovery. So I mean, I can't give cast iron guarantees clearly to anybody, because our economy, being an open economy, is very dependent on what happens outside our borders in terms of particularly the UK, of course, in terms of their economy. But I think we are well placed now, actually, to providing we're able to continue to maintain what we've secured up to this phase, to go into hopefully quite a sharp recovery, with a real community commitment to that, given what we've all been through together.
Yeah, I mean, I think it's where the recovery plan would be very important that we do consider future generations. The States is under resolution to do that. I think it was through an amendment from Deputy de Summeray to make sure that we do that anyway. And I think the recovery plan, again, it's all about getting feedback from the community and the younger generation to understand what it is that will support them for the future, so helping support them with their own businesses, start up, young with new ideas. And so I think that it's through the recovery plan, getting that community feedback. It mustn't be a States of Guernsey plan. It's got to be owned by everybody here, and that includes all generations, quite frankly.
Okay, I'm sorry. I do want to allow time for the questions that have come in. So, Rob, would you mind giving us some that have come in?
Yeah. So we've had lots of questions from children overnight. We asked again for children's questions. We're very pleased in the States Communications team to get lots of them. So I've got a whole bunch here. The first one I'm going to ask is from Aidan, who's 9, and his question is it safe to go to school? I am worried I'm going to get COVID-19 and be very poorly.
Okay, Nikki, I think that's one for you.
So, first of all, Aidan, I do understand that you're worried, and I think that's really important that you express how you're feeling. I think what we would say is that we wouldn't say that the schools were going to open if we didn't feel that it was safe, and I think that's really, really important. I think also, Aidan, is many people that work in public health are mums and dads, and the mums and dads that I've spoken to within public health, all of their children are going back to school. So I think that tells you something, that we do think it is safe to go back to school. But I think, Aidan, you bring up the point about being poorly, and what we are saying to everyone, that's adults and children alike, is if you don't feel well, it's really important that you don't go to school, or for grown-ups or for adults, they don't go to work. And I think that's important because we need to make sure we try and keep everyone healthy. So, Aidan, we think it's safe for you to go back to school, and we hope you have a lovely time.
Thank you. Next one.
Next one is from Noah, who's also 9, and he says, hello, will I have to social distance from my friend even if I really want to play with him?
Well, Noah, yes, going back to school is going to be slightly different, and we absolutely need to say that. But there are going to be lots of games that you're going to be able to do, and your teachers have been thinking very hard about different games that you can do, and perhaps keep that bit of distance between you and your friends. And so listen to your teacher. They're going to have lots of different games for you to do, and I think you'll still find going back to school a lot of fun.
Okay, the next question is from Eliza, who's in year 2, and she asks, why can't I see my older brother at playtime?
Well, for that, what we're trying to do when you go back to school is we're trying to have the classrooms in bubbles. So you'll be with your friends or your people in your class, and when you go to break time, you'll be with that group of people as well. So what we don't want to do is mix 2 different class groups together just for the moment. We will be doing it in some weeks to come, but just at the moment, we want to keep a bit of space between the different class groups. So if you really want to see your brother, what you can do is just ask your teacher if it's possible for you to see your brother, just you and your brother together. But otherwise, if you can just stick with your class group, that's going to be the best for us.
Okay.
We had several questions about hugs from a number of people, including Poppy, who's aged 8, and Kenzie George, who's 3, so from all different ages, wanting to know, when will we be able to hug people?
Well, soon. So, So it should be soon. I think at the moment, again, we're trying to just keep that little bit of space between people. And I know that it's different, and I know that it is tough, because when you see your friends, you're going to be really excited and want to hug each other. But we're just saying, just for the moment, if you can just keep that bit of space, what I would suggest is that you all develop great big air hugs. And I think that would be really nice if you all air hugged each other.
I think we're all looking forward to a time when we all can have a big hugs everywhere.
I think so.
The next question is from Ellie. Now, Ellie is 12, and she's asking, how different will high school be for walking around my school, and am I allowed to sit with my friends?
I don't know if you want to answer, Paul.
Paul.
Well, Ellie, I think, first of all, schools will feel a little bit different, and second, for secondary schools particularly, they will be approaching it with both subject and year group bubbles. So the way you move around will be different, and you'll stay within that bubble a lot of the time. And of course, there'll be additional hygiene measures in place and different arrangement for breaks and lunchtime. But of course, within your year group, you'll be able to socialise and talk with your friends and give an air hug, as Dr. Drinker said. But it will feel a little bit different for the time being.
Okay. Any more, Rob?
The next question from a young person who didn't send in their name, but it's a good question. They wanted to know, am I allowed to have a sleepover at my friend's house in phase 4?
Shall I take that one?
Yes, please.
So depends whether I'd have a chat to your mum and dad, and it depends whether they were in the same bubble that you were originally in. So if you remember when we started coming out of lockdown, we had some bubbles, and if they were in the same bubble, then yes, it would be all right. But you need to chat to your parents about it. If you weren't in the same bubble, I would say it's probably a no for now, but again, things are moving fast, so we think that certainly by the time we get to summer holidays, things will be a lot different. So not for now, unless you were in that same bubble.
Okay, the next question is from Jack, who's 10, and he wasn't the only one who asked, but he wanted to know, am I allowed to play football with my friends at lunchtime?
So football, I'm afraid, is a contact sport. I think any of us who watch a football match, people don't stay away from each other, do they? So what we're saying is that in phase 5, which is going to be in a few weeks' time, football will be okay, but it's not okay just for now. So what we're going to suggest is think of other games. Cricket's one of them, basketball, any game that you can actually stay away, well, probably not basketball, rounders is probably a better example. So any game that you can stay away from each other, that would be the best. So it's still a team sport, you can still have fun, but you just don't crash into each other, so to speak.
Ruben, who is 6, wants to know, where did coronavirus come from?
Ooh, okay. So I've got another public health person, have I? So Ruben, you can come and see me after this for a job. So that would be good. So it's really interesting. So we still don't know for sure, but we think coronavirus originated in bats, and the one that's affecting the population, affecting people at the moment, but then went through what we call an intermediate host, so went through another animal before it got to humans. We're not sure what that other animal is. One of the things that we think it could be is something called a pangolin, which is a scaly mammal. They're very rare, they're an endangered species, and then got from there into the human population. And we think that probably happened in a city in China called Wuhan City, and probably related to some of the markets where there's close contact between animals and humans. So we're not exactly sure, but we think it went from a bat to another animal and then on to humans, probably in Wuhan City in China, but we're not absolutely sure yet.
Okay, my last question from our children's questions today is from Tyler, who is 7. Now, before I ask his question, Tyler did say he wanted to say a big thank you to Dr. Brink, Deputy St. Pierre, and Deputy Soulsby for being so amazing during this time, and a big thank you to Dr. Brink for the bedtime story too. But he does have a question, and his question is, if the virus comes back, will we have to stay at home again and learn there?
So we're hoping the virus won't come back, and things are looking good, but there is always a chance of the virus coming back, and that's one of the things, part of our job is that we're always looking and trying to prepare for things, which is what we did before the first time the virus came. But if it does come back, yes, there is a possibility that you would have to learn from home again. But we're hoping it won't, and we're going to do everything that we can do to stop it coming back. but small chance that if it does come back, then yes, you would have to learn at home again.
Good. Well, thank you very much for those. We've got some time for some other questions. So, Charlie, you have one.
Sorry, just to change the tone a bit. My question was for Dr. Nicola Brink partly about the key workers. You said there's about 600 now who you've been testing on the front line who've been asymptomatic. Just wondering what areas or job roles those are. And also, with regards to the antibody testing, where are we at with that now?
Okay. So the asymptomatic testings are divided into two groups. The one are the pre-surgical ones, which we're doing an increasing number of those, where we're testing people pre-surgery. And that's important because, as Dr. Raby said, is if you get COVID-19 in the immediate post-surgery period, it can be extremely serious. So about half of them are that group. The other half that we've looked at include emergency department staff, ambulance staff, nurses and doctors that worked on Brock Ward, where our original COVID patients were looked after, intensive care, theatre. We're testing the Rini staff, we've tested primary care, we're testing community care staff. So we're going around those. We've reserved certain test slots for teachers over the next couple of weeks. So we're looking at various frontline staff, radiology staff we've tested. So it's just going through all of those groups and looking for subclinical infections. And we've found absolutely no subclinical infections. The second part of your infection is second part of your question, not infection, second part of your question is in relation to antibody testing. So the Roche antibody test, we've got it on Ireland. This weekend we did a validation and we do, it's actually a verification. So we did a verification of the test where we got bloods from people that had the infection, and we tested and worked perfectly. So we're really pleased with that. So we'll go into the clinical testing over the next couple of weeks, and we're going to start off with healthcare workers and then go into other groups. Other group that we're interested in, people that had potential symptoms of COVID-19 but actually tested virologically negative. We might have just tested them too late in the day, so we might do some retrospective testing on those groups. We might also look at contacts of cases. So there are various groups. We're going to start off by testing our frontline workers in the first instance. And that, as I said, using our multi-well assay that we've got on Ireland.
Okay, good. Any others?
Kit Gilson, ITV. A question about self-isolation, really. Going in for operations can be a scary time. Is it possible to for someone to go into voluntary self-isolation with someone who is self-isolating to essentially buddy up in the run-up to the operation?
Yeah. Yes, you can go into self-isolation as a pair, but you need to then stay, both of you need to then self-isolate. So that person needs to be in self-isolation with you. So it's not, well, I'm going to have a buddy and the buddy can pop in and out. It's you're both in self-isolation for that period of time. We understand that a lot of people will find it extremely difficult, and I speak to a lot of people in self-isolation, and it is a difficult period of time. But so as long as that person adheres to the same self-isolation rules, then that's totally acceptable.
Yeah, and I know that's already happened, and people have asked us questions already. Can we do it? And the answer, yeah, as Nikki said, is yes.
Good. Any more? Time for one more. Yep, go on then, Danielle.
Quite long though. Yesterday, Policy and Resources announced a revolving credit facility of up to £225 million with a consortium of 5 local banks for a 2-year initial period to help fund the COVID-19 financial support measures. There's no setup fee details at the moment, or any interest rates or estimates on what the final taxpayer repayment would be and when it would need to be repaid by. Can those details be provided now, given that it is taxpayers' money?
Yeah, not here and now, right now at this event. It's a question which colleagues have also asked in the States, and what I've asked this morning is that we ascertain how much of that information is commercially sensitive, so that will almost certainly involve dialogue with the five banks concerned. I'm not immersed myself in the detail of what confidentiality there is around the terms that were negotiated as part of that facility, but there will be some commercially sensitive information, so I think we just need to cover that off before we can provide any further information. But whatever can be put into the public domain, will be put into the public domain. I can give that assurance. Good. Excellent. Thank you very much. We'll see you all 1 p.m. next Friday. Thank you very much.